of modern Spanish life. In this private hospital, called the Virgin of the Beautiful Water Meadows, a rather unusual event is about to begin, and it may indicate how modern-day medicine can benefit from the potent influence of a patient's belief. This woman, Senora Mari Magdalena Escudero, is about to undergo a full-scale operation, but without conventional anesthesia, or hypnosis, or any chemical painkiller or acupuncture. The whole operation will be supervised by her brother, Dr. Escudero. He is known to the team, as well as to her, by his Christian name, Angel or Angel. Angel has convinced his sister that her operation will be safe and painless if she simply believes in her ability to take control of her body. She merely needs to express that belief with a happy disposition. Her personal companion and constant monitor of her feelings through the operation will be her sister-in-law, Angel's wife, Senora Mari Jesus Escudero. The principal surgeon is not Dr. Escudero, but an orthopedic specialist here in Murcia called Dr. Carlos Clavel.
Carlos, ¿has visto las marcas? Sí. ¿Son correctas? No, la he cambiado ya.
Since childhood, Senora Escudero has suffered from a slight bowing of her leg bones. Now, in middle age, that misalignment within is giving her arthritic complications in the knees. The intention today is to break the bones in her leg and then pin them into a straightened position. The surgery itself is conventional. Patients who follow the Escudero approach to anesthesia are often observed by visiting doctors. In this case, Dr. Michael Whiteley, OBE, a British surgeon who has retired to Spain but retains a continuing interest in anesthesia, and Dr. Amalia del Palacio, a research biologist from Madrid. She is also interested in how such patients can possibly achieve anesthesia through willpower alone, if they do. Certainly, Senora Escudero presents no hint of anxiety, let alone panic, that would oblige Dr. Clavel to question whether it was prudent to proceed. Before any incisions into a leg are made, it is common surgical practice to hold the leg up and, using a rubber bandage, squeeze out much of the blood past the loose tourniquet wrapped around the thigh. Once this is done, the tourniquet can be inflated to maintain the tourniquet's grip on the leg throughout the operation.
It's just the dry colour of the skin and the yellow fat underneath, and no blood. You can see exactly what you're doing.
I see.
But the tourniquet's constant tight grip might itself be numbing the leg somewhat, and so reducing sensation in it.
Aunque quiera. ¿Y tienes las manos de alguien más puestas?
Sí, sí.
¿Y qué sientes al contacto de las manos?
Sí, también me va.
Muy agradable. ¿Y qué sientes cuando te toca a ella? ¿Ella? Sí, cuando te coge la mano. ¿Y a ti te gusta que te cojan la mano?
Sí.
O sea, que ella es como una hermana para ti.
No más.
Más que tu hermana. Bueno, eso es fantástico de oír.
But having a positive attitude is not the only requirement of Angel's psychological form of anesthesia.
Perfecto. Saliva líquida. Tú sabes lo que significa eso para conseguir la anestesia psicológica. Tener la boca húmeda y pensar en la anestesia es suficiente para tenerla. Tú lo sabes.
Doctors Del Palacio and Whiteley have been told by Escudero prior to the operation to keep watching the patient's mouth. Saliva is a vital adjunct, in his view, to maintaining her happy disposition. A dry mouth would be, for Escudero, a symptom of fear or potential panic.
Puedes observar que la piel está seca y sonrosada.
The operation has been underway for the last 5 minutes. A deep incision in the side of the lower leg has been made and an access tunnel prepared to the fibula, the smaller of the two bones below the knee.
Tú y yo podemos hablar, no pasa nada, no interferimos.
Yo creo que no, que es muy importante que hablemos con ella, entre tú y yo.
Por eso te he dicho, tú y yo podemos hablar.
Sí.
Antes es que...
The surgical objective with the fibula is to remove a wedge of it to allow it some flexibility. If it can then be bent without breaking, that will provide leeway for the later alignment of the shin bone or tibia. There are two ways of removing the wedge of bone. The first one involves a saw blade vibrated by a drill.
Agua no tenemos, ¿verdad? Agua, danos un poquito de suero.
Quite apart from the pain sensors in the skin that are still being stimulated by the holding instruments, the sawing is now assaulting the pain sensors in the bone. This would normally be an excruciating experience for anyone.
¿Tienes agua, Carlos? Que el paciente nos dice, no se lamenta, no se queja de nada, se siente bien en la mesa de operaciones, no hay reflejo de defensa, cosa muy importante, está la zona donde estamos operando quieta completamente, inmóvil, operamos con toda normalidad.
This operation has been going on for 20 minutes so far.
Carlos, ¿qué sutura quieres? ¿Dexon tercera?
Sabéis que uno de los signos del dolor es la midriasis, la dilatación de la pupila. Aquí no se da.
Te pinta el ojo, ¿eh? Que te veo yo.
The operation on the fibula is virtually complete, and the patient's pulse rate has remained so far both low and steady.
Tiene 20 pulsaciones menos que antes de empezar la intervención.
The major stage of the operation now takes place just below the knee on the tibia or shin bone. The surgical team proceeds with it and with the further demands it makes of the patient, still quite unconcerned with the possibility of her being upset in the process. According to Escudero, even though his patients remain fully conscious, they neither panic nor lapse into shock.
No tapéis el monitor, por favor.
The usual surgical procedure now is to drill a steel rod into place, which after some further wedge removal will then hold the tibia in a correct realignment.
¿Fuera rayo?
It should be remembered that there is no evidence here of anesthetic or other drugs, or of acupuncture or hypnosis. Indeed, Escudero insists he never uses such techniques. It would seem then we must be looking at an example of mind over matter. Astonishing though it may be, this patient is still apparently feeling no pain.
¿La luz? ¿Coge tú? ¿Quieres la luz? Sí.
No tiene mucha calor. Sí, ¿eh?
Dobla un poquito la rodilla. Ahí. Si la apretas, la mano.
Marie Magdalena's husband has been able to watch all of the procedure from the outset and to offer his moral support from the observation room.
¿Cómo estás de bien, nena? ¿Qué tal?
De gloria.
Relatives, if they wish, are allowed by the patient's side to supplement the comforting role that Angel's wife provides. The final stage of the operation involves another assault on the patient. An additional rod is set in lower down the leg, to which an external adjustment pin will be attached. Maria Magdalena's nickname is Maruja.
Maruja, ¿quieres decirnos cómo te encuentras en este momento y cómo te has sentido en toda la intervención?
Estupendamente. Maravillosamente.
¿Qué sensaciones has sentido durante todo el tiempo?
Muy agradable.
¿Quieres que te diga?
No.
¿Cómo estás de bien? Ya han terminado.
Whatever is going on here, this operation and the patient's response to it lie completely outside the conventional wisdom of modern anesthesia.
Me parece fantástico cómo funciona el mecanismo. Todo lo tienes tú y tú lo tienes tú. Pero me parece fabuloso.
You say in Spanish, the proof of the pudding is in the eating. You know the expression?
Ah, la prueba del que el pastel es bueno se tiene cuando se come.
Cuando se come.
Y es lo que estamos viendo ahora.
Perfectly. Levántala. Bueno, ahora quitan la compresión y pasa la sangre, piensa, mis arterias se dilatan fácilmente, llega la sangre a mi pie con toda facilidad. ¿Notas calor?
Noto un calor.
¿Notas calor?
Qué calor más suave. Una cosa, que me corre hacia abajo.
Clearly, some suggestion, if not hypnosis, is going on to a fair degree, though the patient has certainly remained conscious and participant through what would normally be a severe ordeal.
Cuanto puedas lo vas moviendo.
Ya.
Muy bien. Ahora,
Quite evidently, she feels no after pain, though she has now felt a change of temperature. So which sensations she is somehow able to block out are quite distinctly selected by her. She can feel heat and normal sensation, but no pain.
muy bien. ¿Sigue moviendo?
Sí.
¿Se van calentando?
Ya está caliente.
Ya está caliente.
Sí, ya lo noto perfectamente.
Bien.
En 2 o 3 veces o 4 horas.
Touching. Kissing. Well, that is not so unusual in this country, especially in this moment.
Levanta, estírala completamente. Muy bien. Mueve el pie hacia arriba.
Dr. Clavel has good reason to be pleased with Maruja's right leg, as well as with the new alignment of her left one.
Ahora mismo están prácticamente iguales. La misma, aunque tiene aquí el vendaje, pero se nota la misma convergencia. Perfecto. ¿Si quiere examinar?
Clavel also operated on Maruja's right leg and straightened it 16 weeks previously, and in exactly the same way, with her using her brother's psychoanesthesia alone.
Has good movement.
Dr. Escudero also claims that after his patients have used his psychoanesthesia techniques, all their post-operative wounds heal fast and without inflammation.
And if we look at the leg, you can see the scar of the previous operation over the upper end of the tibia, very close to the knee joint. The places where the pins were put through at the previous operation. And then lower down the leg, the short scar over the fibula. The leg is straight and compares very favorably with the one that's just been operated on.
Maruja, ¿la han operado alguna vez en su vida con anestesia convencional?
Sí.
¿Y para usted cuál es la mayor diferencia entre la anestesia convencional y esta técnica que ha sido utilizada hoy aquí?
Eso de entrar muerta o que te dejen muerta, eso para mí es algo horroroso.
Y doctor Clavel, ¿le podría hacer una pregunta? ¿Cuál, desde su punto de vista, qué es el futuro de esta técnica?
Yo después de ver el resultado que da aquí, pienso que se puede hacer cualquier tipo de cirugía. Pero el futuro de toda esta técnica va más allá de la cirugía. Va a un mejor conocimiento de las propias capacidades humanas para usarlas fundamentalmente aprendiendo a vivir mejor, aprendiendo a vivir más felices, de manera que esa propia felicidad sea la puesta en marcha de una nueva medicina preventiva. You can change your life doing two things. Using positively your thoughts to program your own brain and having every moment liquid saliva in your mouth. With these two things, the